Hello everyone, my name is Lena Tonyango, a clinician who is very passionate about health sensitization. Today I'll be taking you through a very interesting topic called breast cancer. What is breast cancer? What are the clinical symptoms? Things that if you feel back at home, then they should prompt you to see the doctor. How can you make the diagnosis of breast cancer? What are these treatments of breast cancer? And then the prevention. Now, just a small highlight. Breast is made up of fatty tissues. And then in these fatty tissues, we also have whatever we call the lobules. And then in these lobules, we also have whatever we call the ducts. Ideally, milk usually passes through the ducts to the nipple so that the baby can do what? Can breastfeed. I'm mentioning these two, the lobule and the ducts, because mostly the cancerous cells originate from these two areas, majorly. We have other types of cancer in the cell, in the breast, but the two major ones are those two. Breast cancer occurs when now the normal cells in the breast, we have the normal cells multiply abnormally and very fast, and then they form whatever we call the tumors. These tumors are what we call the breast cancer. Breast cancer is very common. It's a very common disease. It's a killer disease. Among the cancers in women, actually it is the second cancer after the lung cancer in women. It's more common in women than men. If you randomly choose 8 women and then put them together, examine their breasts, you may find that out of the 8, one might be having breast cancer. Breast cancer is not limited to women only. Even men can have breast cancer. But it is rare in men. Out of 1,000 men, you might find 1. It's a disease that if it's identified earlier, then it can be managed so well. The only problem is after we identify it so late, or you have the clinical symptoms and then you keep quiet up to late. By the time you're getting to the hospital, the cells have metastatized. They have moved or they have spread to other areas, other parts of the body, other parts of the other organs. And this now makes it difficult for it to be treated. Now, moving to those symptoms that might make you think or might make you rush to the hospital to see the doctor. Examination of the breast is always very important. Don't wait until you get the symptoms, is when you rush to the hospital. But now, what are those clinical features that might make you to rush to the hospital? 1, if you examine your breast, you palpate your breast, you feel that there is a mass that is abnormal, then you need to see the doctor. If you look at that breast, you feel there is some ulceration or even see some ulceration on your breast, just rush to the hospital so that the doctor can examine you. There's a nipple discharge. This discharge can be clear or it can be bloody. Please see the doctor. Color discoloration. Nipple discoloration or skin discoloration of the breast. This one should also prompt you to see the doctor. Nipple retraction. Ideally, the nipple should be sharp. But if it is now retracted, then that should trigger your mind to see the doctor. How about the advanced symptoms? We've just talked of the general symptoms, but how about the advanced symptoms? A patient might present with cough, chronic cough. This means that the disease has now spread to other organs, like maybe the lungs. Someone might present with severe lower back ache. Then there's a metastasis to the lower back bones. Someone might present with jaundice or yellowness of the skin or of the eyes, then it means that the liver is already infected, or there is a metastasis to the liver. We now have several other symptoms that can pop in once there is a metastasis. It is through visiting our doctors that we can realize where the problem is and it be corrected. We also have the risk factors. What are the risk factors? The things that predisposes you most to breast cancer. One, age. Ideally, we talk of age from around 40 years. But it is not limited to that. We have young women at their 20s, young women at their 18s, young women at their 30s who have been diagnosed with breast cancer. So it is not limited to that. It's only that a larger percentage can be found from 40 years. Two, the use of contraceptives. Ideally, these contraceptives, they also have hormones. Remember, you have hormone in your body. But again, if you add other hormones, because the contraceptives, they also have hormones in them, then that can predispose you to whatever we call the breast cancer. Smoking and alcohol consumption, that's another thing. Family history of breast cancer. In the family, maybe your mom, maybe your grandmother had a breast cancer. This is a predisposing factor. We have some genes that can predispose you from breast cancer if you inherit them. Null parity. That is, someone who has never given birth. It's not a crime not to, but this is a risk factor. Or giving birth at an older age can as well predispose you to what? The breast cancer. Now, you've come to the hospital. I'm there seated. What happened now? How will I screen you? How will I know? First of all, there's what we call self-examination. Self-examination, that one you can do by yourself. You can even come to me and tell me, Doctor, you see, I examined my breast and then I realized I have a mass or I have a lump in my breast. You see, Doctor, I examined my breast and then I realized that there's a discoloration. The color has changed. You see, Doctor, I have some ulcerations that I can't even tell where these ulcerations are from in my breast. Doctor, I have a discharge. Now, from this history, I'm good enough to make a diagnosis, to make a provisional diagnosis. I can say it so. Another thing that the doctor will do is you can send for an ultrasound. In the ultrasound, it will tell us actually if we usually have whatever we call it will tell us if it is fluid-like or if it is solid. If it is fluid-like, then the doctor might say that it's benign or just a cyst. If it is solid, then it can be benign and cancerous. We also have whatever we call mammogram. Mammogram is a bit extensive as compared to ultrasound. Ideally, ultrasound we recommend for women who are below 40. And then above 40, we recommend mammogram for them. And then another one is biopsy. Now, biopsy, this is where now you've realized there's a mass or there's a lump in that breast. Now, there will be incision that will be made at that area where there is a mass. And then a tissue will be taken from that area, the suspicious area. And then after that tissue has been taken, it will be taken to a pathologist doctor to analyze it. Then a pathologist doctor will look at this tissue in the microscope and do the analysis for us now. The pathologist doctor will give us a report if it is cancerous or not. And if it is cancerous, is it as a result of estrogen receptor? Is it as a result of progesterone hormones? He or she will give us that. And then from there, you will be able to give the right medication to this patient. MRI is actually preferred over mammogram because there are some. Remember, the only mass that you can feel is that palpable mass. It's large enough for it to be palpated. But once you have this large one, you might find that you have other small ones as well. Now, the other small ones, maybe the mammogram cannot capture. So we come in with the MRI to capture every mass that might be around that area for them to be analyzed through biopsy. Good. It has been analyzed, and the bad news has come that the tissues are cancerous. Now they have to go ahead and do whatever we call staging. It is through staging that the oncologists now, the doctors that are now specializing on treatment of cancers, can be able to do their treatment well. We have stage 1, we have stage 2, we have stage 3, we have stage 4. Treatment will always depend on how these cells have spread to other organs. And then now we come with the treatment. We have surgical, which is the most preferred, especially if we are in our early stages. Let's now move to treatment of breast cancer. We've been diagnosed. The cancer cells have been identified through biopsy. Staging has been done, and now we need to crop in with what? With the treatment. We have surgery. Actually, this is the gold standard treatment. But it is a gold standard treatment if it is detected early. Surgery can be done. We have different types of surgery that can be done. We can do whatever we call lumpectomy. Lumpectomy, that means that lump and maybe the tissues that are just near it are removed. And then you follow it by radiation. Radiation, that is the use of X-ray to kill the cancer cells. Chemotherapy is as well there. That one we use the drugs. And then the hormonal therapy, we use the drugs as well to help us do what? Do the treatment. Apart from that, we have some myths. Now, what are these myths that they usually talk of? I'll just mention a few. With us medics, we don't go with those myths. Someone will tell you that, you see, if in the history of our family, there's none with breast cancer, then I can't have it, please. Remember, I talked of other predisposing factors, so please don't go by that. Another one will tell you that if you wear a bra, then you will do what? You'll have a breast cancer. Who said so? That's not the case here. Other myths, you know them better. I don't want to mention them. Someone will even tell you that if you put a phone in your pocket, then someone might have a breast cancer out of that. No, those are just myths. Prevention is better than cure. And knowledge, I repeat, is power. If there is anything that we can do to prevent this, the best thing is to seek medical attention, to go for the breast screening, so that we avoid this killer disease by all means. In my next topic, I'll be handling a prostate cancer plus benign prostate hypertrophy in men plus women. Prostate cancer and benign prostate hypertrophy. Thank you so much. Let's meet next time.